Hey guys, Dr. Derry here, owner of Revision Health Services in Jacksonville, Florida. And I'm excited for a topic today because I often treat people with sciatica, but we're going to cover what sciatica is and how to get quick relief. And this is the absolute truth you need to know about sciatica. So sciatica is often a term that I hear with patients all the time about pain down their leg, numbness, tingling, nerve burning. You can have any of that, absolutely any of that. And sciatica can be painful at times and often pain in the butt, actually. And so I want to go over what actually sciatica is. And so we may think that the pain can start from our butt and go down our leg, and that you can have pain really anywhere in the pathway of the nerve. And I'm going to go over that in a second, what the nerve pathway looks like in some individuals and most individuals, stuff like that. And so the sciatic nerve is a big, thick nerve that exits from the lower part of your back, the lower part of your spine, comes into your buttock and goes down your leg. And so you can have pain anywhere down your leg or in that referral pattern. And you can look for certain things. And so a lot of people think they may have sciatica, but as a physical therapist and other providers, we do what's called a differential diagnosis. And so sometimes it actually may be nerve related, but I often find that you can have referral from the hip, the back. And so that's where a good physical exam can come in place. But let's say you do have sciatica. Let's say it's true nerve pain down your leg. You're the numbness, tingling, burning. You do have the symptoms into your foot, and maybe you do have some symptoms into your lower part of your calf. And we're going to go over those areas, but a lot of people think that, the sciatica is anything down your leg, where it actually has to meet certain check marks. And so let's say you've had an exam, you have sciatica, and we're going to learn how to make that better and what that can look like. So stay with me here. So guys, we're looking at your back. This is your sciatic nerve that we're looking at, that big yellow string looking thing going down the back of your leg. And it exits out of your lumbar spine near the beginning of your sacrum, your lower lumbar spine. This is the part of your butt muscle that's cut away. That's why when people with sciatica, they often are pointing towards their butt and pushing into there, just because it's deep. It's a deep, deep nerve. And so you have your piriformis muscle that sits right there. Fun fact, in a small percentage of people, the sciatic nerve goes through the piriformis muscle. And so it can often cause some sciatic-like symptoms, even though it's not true sciatica, it may feel that way. And so the sciatic nerve goes down the back of your leg, underneath your hamstrings, in between your hamstrings, in between and around some other stuff as well. And at the back of your knee, it actually splits. And so people with true sciatic pain, you may have some sort of numbness, tingling into your foot or your calf. And so the pathway, their distribution is important. But a lot of people know what that is and what that feels like. And so you can have anything along those lines. I've treated patients who just have butt pain. I've treated patients who just have calf pain. I've treated patients who don't have pain at all, but just have numbness and tingling in their foot, and that's all fair game. And so when you have that type of symptom, you may have sciatica. Before we get onto the table and start doing some exercises, my top 3 things that I think you should be doing for people who have higher levels of pain, nerve pain related to sciatica, and we're going to go over that in a minute. But before I get there, I wanted to go over how do you get sciatica pain relief fast, right? We're not dealing with muscle, we're not dealing with tendon, we're not dealing with bone, we're dealing with nerve. And nerve is its own special being. Unfortunately, it's painful, super painful. It may be hard to identify. It's that numbness, tingling, burning, sharp shooting, stabbing sensation that you can have anywhere from your buttock to the back of your leg. It sucks. I know it does. I've had it myself. And I've helped myself as well. That's going to be another video, but how do you get fast pain relief when you have nerve related symptoms? Nerves need 3 things. They need space, movement, blood flow. You need those 3 things. And so you can pretty much explain any nerve issue due to those 3 things. So let's say that you have sciatica due to a disc herniation. It's a space issue, right? You have that herniation that moves into your spinal canal, space issue. Let's say you have sciatica due to stenosis. You're an older adult, you have difficulties walking for long periods of time, you have the pain down your leg, right? That's a movement issue as well as a space issue. And so when you have a movement issue or a space issue, or one or the other, you have a decrease in blood flow to the nerve. And so we're going to go over some techniques today as well that can help improve that blood flow. So you need those 3 things. And so every time I treat a patient with nerve issues, I have plenty of them now, it's space, movement, blood flow. And after you get done with the techniques, you should have immediate relief. So these are my top 3 exercises for someone who has hot, heavy nerve pain related sciatica. You know who you are, but man, it's the pain where you walk and it shoots down your leg, you can barely sit, you're having a lot of discomfort moving around. If someone tells you that you have sciatica, your physician may have helped you by giving you some sort of nerve medication that can range from gabapentin to other ones. And it's just to help calm down the nerve. Remember, the nerve needs three things: space, movement, blood flow. So we're going to go those three things, and these exercises reflect those three things. So hang with me. We're about to go over the pelvic tilt. We're about to go over the cat camel, and we're about to go over nerve glides. Now, the nerve glides get a little tricky, so hang with me. There's going to be some steps there. But if you really want to know more, there's a link in the description about those three exercises, as well as how to do it, when to do it, how many times to do it, and what it should feel like when you do it. I highly recommend looking at those because we're not going to have time to go over all of that today. But let's get started with my three favorite ones for those who have hot and heavy sciatic pain. So the pelvic tilt, you're laying on your back, your knees are bent, your feet are flat on the table or the ground. And what you're going to do is you're going to tilt your pelvis backwards and forwards. And what I mean by that is you're going to try to flatten your back, then you're going to try to arch your back. And so if you have heavy nerve pain, the flattening of your back might actually cause symptoms in your foot or your calf or your buttock. That's absolutely okay. With nerve stuff, when you have that rush of blood flow, right? They need space, movement, blood flow. You can have a quick onset of discomfort. But what I encourage people to do is just keep going, see how it feels. How long you should keep going and how many reps you should do. I usually go higher. It's not strengthening. So you want to go around 30, 40 reps. That's okay. So we're going to move on from the pelvic tilts. And then after you've got things moving, space, movement, blood flow, you're going to go to the cat camel. So on your hands and knees. And it's not the arching of your back, the dipping of the back that people can often think that's going to cause them symptoms. It's really the curving, right? So creating that arch that at the top, that can sometimes create your symptoms. And so again, you want to try to work through it and try to notice that you're going to get better as you go. This stuff should never, ever make you worse. And so if you're having lingering stuff afterwards, that is something that maybe we did too much or your position wasn't right. And if you're having that much discomfort and it's sporadic and you can't really control it, we really should get some help. And so the sciatic nerve stuff can be tricky. You need to have someone to help encourage you along the way. And so really take a good look at your body. That's beyond the scope of this video and the intent. But I found that people that can kind of work through it themselves and have good knowledge about their body, they're very self-aware, can do really well with this. Now, the final one is the nerve glide. Now, this is the bread and butter. And I'm going to create a separate video regarding the nerve glides because that's how I help my sciatic pain from a disc herniation that I recovered from. And so you want to be able to be good at these. This tensions the nerve or slides the nerve because nerves are much like other parts of your body where they move with every step we take and everything we do, but it's the sensitivity from the decrease in space, movement, or blood flow. And so you want to be able to be good at these. And so you're going to notice that my one leg is bent, my other leg, I'm supporting, then I lift it up and I bring it back down. When you lift it up, you may notice you have symptoms. Actually, 90% of the time people have symptoms when you have hot and heavy nerves. That's who this video is for. So when you have those hot and heavy nerves, when you first move into it, man, it can really light you up. It's like a light switch though. When you bend your knee and it comes down and it's relaxed, gone. When it comes up and you kind of straighten your leg there. Well, it's a light switch phenomenon, right? It's a nerve. We're dealing with electrical-like pain. And so you're gonna have electrical-like symptoms and representations. So it's on, off, on, off, on, off every time you lift up and down. People are amazed by this. They don't know when they're supposed to feel like that. It normally doesn't feel like that, but it is good for the nerve. So repeatedly do it, 30, 40 reps, and let me know how you do. Hey guys, thanks for hanging out with me in this video. I hope you found it beneficial, but we talked about what sciatic nerve is, what it truly is, what sciatica really is, and the three things nerves need to feel better. And so that's how you get pain really fast is you understand what the nerve is and you understand where you are in that process. Hot and heavy nerves, more mild, more moderate. And so it just depends. It really depends. And so that's why a good physical exam can go somewhere. How do you get pain really fast? Need space, movement, blood flow. What is sciatica? We covered that today. We ran from anatomically what we're looking at. So what it looks like in your body and what it actually is and what you feel. And so what is sciatica and how do you get pain really fast? Well, this is what we covered today. And so guys, thanks for hanging out with me. Again, this is Dr. Derry with Revision Health Services, and I appreciate your time. I hope you found it beneficial. Again, sciatic nerve stinks. It's not very much fun. And if you're going through it, I'm really sorry, but there is recovery ahead of you and it's not a death sentence and you will get better. But until then, stay healthy and keep moving.